All right, I think we're ready to start. Welcome to the third of six Sophie and Alex Rosner seminars in health, history, and social justice. This is actually the third successive week of talks. We're very excited to welcome Dr. Abdul El-Sayed, a health activist and former faculty member here. And I'll say a little bit more about Dr. El-Sayed in just a second. Let me first just do a little housekeeping, though, before we delve into not only his many fascinating political endeavors, but I think an equally fascinating life story. I just want to say a quick thing about our scheduling. These talks have been a little compressed at the start, and that's just because of the election and early fall seasonal things that have required some unusual top-heavy October compression for scheduling, but we'll soon be going back to a little bit more of a spaced out calendaring. And of course, these talks always will be on YouTube shortly afterwards. We always open by first acknowledging the labor behind these talks. Simon Mack for helping us with the Zoom technology here. Our superb PhD student, Sadie Bergen, who helps make sure things work smoothly behind the scenes as well. Andrea Constancio and Yasmin Davis in SMS for helping us get the word out. Tara Terpstra from Dr. El-Sayed's team, who helped figure out scheduling, and our own Professor Jennifer Hirsch, who put us all in touch in the first place. Besides giving thanks also to these folks at the top of the lectures, we also like to explain who this series is named after. Who were Sophie and Alex Rosner? Well, at the simplest level, they were the parents of David Rosner, one of our faculty members, a distinguished historian. Sophie was, like David, a teacher. She was a school teacher, and Alex was the editor of a working class newspaper called the Hungarian Word. And like Dr. El-Sayed, they were activists who supported the labor movement, the civil rights movement, and they paid a price for that. They suffered severe professional reprisal in the era of McCarthyism. Our rule for this series when we pick speakers is really pretty straightforward and simple. We basically want folks who continue in the spirit of Sophie and Alex's vision and optimism and their refusal to just be resigned and cynical. And Dr. El-Sayed is someone who I think really clearly clears this requirement with ease. So let me introduce him just briefly. He began his adult life on an incredibly impressive path, but one that over time I think actually became much more unpredictable than he probably could have imagined. His adult life began at the University of Michigan, and afterwards he stayed there for a couple of years for medical school. But then he got a little something called a Rhodes Scholarship and went off to Oxford, where he earned a PhD in public health. And then he subsequently came back to the United States to what would be his home for a number of years, that is Columbia University, right here, where he finished off the medical degree, but also became involved in a number of epidemiology projects, many with the distinguished epidemiologist Sandro Galea. And he worked on a number of issues around racial health inequality, the health of Arab Americans, the consequences of food environments, and was an assistant professor in epi. And for a while, Dr. El-Sayed looked like he was on his way to just a really distinguished scientific career that would last for many decades. But then his life took a big turn. Dr. El-Sayed grew up in the Detroit metro area. As many of you know, after decades of private disinvestment, but also public neglect, Detroit in 2013 filed for bankruptcy, and there was a very radical restructuring of many city functions. And Dr. El-Sayed left his position here to become Detroit Health Commissioner, where he led a number of community health initiatives. And then in December 2018, I'd say this was like version 3.0 of Dr. El-Sayed. He ran an unabashedly progressive campaign for governor of Michigan and came much closer to winning that than a number of pundits had anticipated. In this campaign, he really foregrounded healthcare access, labor politics, negligence in the Flint lead poisoning crisis, environmental health issues. And I think that brings us to where he is now. He is author of a terrific new book called Healing Politics, which sort of blends biography and political text together. It is endorsed by Senator Bernie Sanders, Naomi Klein, Cornel West, AOC, many others. And he's got another one coming out soon called Medicare for All, a Citizen's Guide. And if that's not enough to keep him busy, he's also a podcast host of a great health politics podcast called America Dissected. America Dissected. So you can plug that into your podcast app programs. A lot of health podcasts out there, but far fewer on health politics. You also see him on CNN very frequently, and you'll find him throwing himself all the time into supporting all kinds of good causes around the country. Our format here will be pretty simple. Dr. El-Sayed will give a brief overview of what he's up to in the larger social justice project he's a part of, maybe 5 to 7 minutes, 5 to 7 minutes or so. And then we'll have a conversation. And then as usual, we'll end with audience questions. If you want to ask a question, just hit that icon at the bottom of the screen that says Q&A, type the question. You can do that whenever, 15 minutes in, 30 minutes in, whenever you want. If you want to ask it on video, just type the words video after the question. I find with a lot of people as accomplished and as decorated as Dr. El-Sayed, there can definitely be a certain air to them, but it's the exact opposite with him. I've observed how he interacts with people, and it's always with approachability, kindness, compassion, and empathy, which is a theme and a word that's very central to healing politics. And we'll talk about that in a bit. So without further delay, Dr. Abdul El-Sayed, welcome back to Columbia, at least digitally.
Thank you so much. I really wish we would have been able to do this in person. It would have been really nice to be back at the Mailman School, which to me is both an academic and intellectual home, and a place where I'm really grateful to have a number of friends doing incredible work, including you. Really grateful for the time and space. I want to actually talk today about my grandmother because I think understanding her is central and critical to understanding both our topics today, and also how I've tried to weave a career between them. My grandmother was the smartest and most intelligent and wisest human being I've ever met in my life. She had this incredible temperament, this ability to bring out the best in people. But she'd never gone to school, and she was raised in the 30s, 40s, 50s in Egypt, where women in her class, working class women, just didn't get to go to school. She got married in her teenage years and had 8 kids, 6 of whom lived past their first birthday, 2 of whom died before the age of 1. She had a personal infant mortality rate of 25%. And many summers of my childhood, I would get on an airplane, and it would take me from my Metro Detroit suburb where I grew up to a working class part of Alexandria where my father grew up. And I'd spend most of my time with my grandmother and my grandfather and my aunts and uncles and my cousins who lived literally and figuratively a world away. And my teta had this ability to see beyond the institutional spaces that she was denied, and had a certain understanding for what the implications of institutional optionality were for a woman who had none. And when I'd go, right, I was sort of her ward. She was the key caretaker of me, and my parents, wouldn't often come, so it would just be me and my Egyptian family there. And she would take it upon herself to sort of try and break down my ego. So she'd point to one cousin and say, "That one's smarter than you." Point to another one and say, "That one's better looking than you." Point to a third one and say, "That one's taller and better at sports than you." "That one's nicer than you." That one, and it would go on and on until I felt like I was the lowest of my cousins. And the point that she would make at the end of it is that the difference is that you have an opportunity and they don't. And it was an incredible ability to look beyond her own life into mine, and to force me to come to grips with the fact that the thing that had happened for me is that I was lucky. I was on the study end of a cosmic analysis of sorts, where I'm the one who gets to be born to the one of her sons who gets to move to the United States. And I get opportunities and my cousins, just as smart, just as capable, don't. And in a lot of ways, it was those trips and then my time with my grandmother that led me into a career in public health. Because the crazy thing is I could travel 15 hours and travel 10 years difference in life expectancy. And I could see it written on the bodies of the people I would spend time with. And what was even crazier than that is that if I were to take I-75 South for 15 minutes, I could travel the same type 10-year life expectancy gap. And having lived with a front row seat into poverty and lack of opportunities through my cousins, I was in this incredible space where I could understand the consequences of poverty, but I never had to be affected by them. And I say incredible not because it's the way the world ought to be, but because it's so rare. And so, for me, I wanted my career to be about addressing that. I didn't want to be the only one with opportunities. And I thought that the way to do that was through a career in medicine until, of course, I started training in medicine and came to appreciate that in so many ways, our healthcare system, both locally and globally, is a part of a problem. And that's what led me into public health. And I really enjoyed my time as a professor, but felt that so much of what my colleagues were so much better at than me was about doing the studies. I was always a lot more interested in what we were going to do after the study was done. How are we going to take this and use it to petition a policymaker or get it into the public consciousness? And recognizing the sort of lack of fit for me in the academic space was what led me to think beyond the work that I was doing as a professor. And one thing led to another. I got this opportunity to serve in Detroit. My job was to rebuild a health department that had been privatized. We talk about defunding police. City of Detroit made the decision to defund public health, and my job was to rebuild a department with 5 city employees and 85 contractors in a city with the highest infant mortality rate in America, 4-fold the probability of lead exposure and 3-fold the probability of asthma hospitalizations. And in that role, we were able to rebuild an agency, took it to 220 employees overall, multiplied its city funding tenfold, and we're able to really kick off a number of projects that that still are ongoing around lead, around asthma, around environmental justice, around vision deficits, around infant mortality and prematurity and teen pregnancy. And yet, so many of the projects that we wanted to take on led us to the doors of politicians, and those doors were almost always closed. And that was the moment that, for me, I had to really think a lot about what my teta would tell me, because I remember when I was awarded a Rhodes Scholarship, and my teta had passed by then, and I was reminiscing about her with my father, and I wondered, if I had told her about this, what would she have said? And my dad, without skipping a beat, said, "And what are you going to do with it?" Right. And so, I had to ask myself, what are you going to do with it? I'm watching Flint poisoned by the same city politics or same state politics that had shut down the health department that I had just rebuilt. And I watched Donald Trump get elected president. And I had always thought that politics was explicit politics was out of bounds for me. And that was largely because of my name and faith. I was the senior speaker at my college commencement, and the main speaker, who anybody actually went to go hear that day, was President Bill Clinton. And I talk about this experience in my book, but I gave my speech and I practiced it over and over and over. And I gave a pretty good speech. And Bill Clinton, in the middle of his speech, talks about my speech. And it was the first time I think my parents ever clapped for me, by the way. But so afterwards, I'm looking at him, and he's being swarmed by a group of university higher ups. And so I just decided I'd walk away. And I felt a tap on my shoulder, and it was President Clinton. And he looks me in the eye. And Bill Clinton, like, whatever you think of his social policy, I have a lot of opinions about his public policy, particularly domestically. He had this rare ability to just like look through your soul. So he starts to look through my soul, and he asked me, he's like, "Son, why are you going to medical school?" And the first thing that came to my mind was like, well, I'm brown and Muslim, and that's just what we do. But I caught myself, and I was like, well, I love people and I love science, and this is how I want to serve. He said, you have a gift for communicating. Maybe someday you'll run for office. And I literally, flat out, without missing a beat, I look at him, I said, Mr. President, that's really kind of you to say. I don't know if you saw my first name. There are 11 letters in my first name, and that's just my first name. People like me don't get to run for office. And he like didn't even deny it. He was like, yeah, that's probably true. A year later, I watched Barack Hussein Obama run for and win the presidency. And that was the first time I ever saw myself at all reflected in politics. And again, I have a lot of opinions about Obama's ultimate policy wins and losses. But it was the first time I saw anyone who looked remotely like me. I mean, you know, his father immigrated from East Africa. My father immigrated from Northeast Africa. He was raised in a mixed household. I was raised in a mixed household. Everybody thought he was Muslim. I'm actually Muslim, and so you know that sort of changed my mind. And 10 years on, I'm sitting here asking, what's my responsibility? What am I going to do with it? And that's when I went into politics. I look forward to the rest of the conversation, but I wanted to share that because I think there are a couple of things that I wish I would have thought through when I was in the space that I think many of you are sitting in. And that's number one, is that, you know, we tend to believe that because we may choose not to be involved in explicit politics, that we are avoiding politics. But politics is a truth. It's like there are two human facts, and they are love and politics. And politics exists because it is the system by which we choose to allocate scarce resources. And there are different kinds of politics. There's a politics of power, there's a politics of fear, there's a politics of hope, there's a politics of equity. And the choices that we make about how we engage in politics, not if we engage in politics, but how we engage in politics, is about what kind of politics we want there to be. And I think we have a responsibility in a profession that is focused fundamentally on the well-being of people and the equitable access to long and healthy lives, that we be involved in politics, and we be involved in politics in a very explicit way around the ideals that we think our politics ought to enshrine. The other point of it is that public health has always been political. It's just this is the first time the public's seeing it, and you know, it's seeing it in a pretty profound way. And this is a moment that I actually think we're missing, and partly it's because we have failed to be nuanced as a public health community about the means to getting to the truth versus the means of communicating truth. And we're very good at empirics in public health. We're very good at identifying the correct answer to a problem because we stripped away all of the spin to actually get to an empirical question and then some answer to that empirical question. The problem is that we assume that because we have gotten to an answer empirically, that the best way to communicate that answer is also empirically, which could not be further from the truth. Because part of the process of being educated as a public health professional is to learn the process of empiricizing. And most people have not gone through this training. And so the natural way that we communicate is to tell stories. And in going through our training, I always joke that we've been mismented, not demented, but we've been mismented. We've been taught to think in a different way. And it's not that we think in a right way, it's that we think in a different way. And we think that everyone else ought to think or does think the way that we do. And then we communicate in that mismented way to people who are not themselves mismented. And we wonder why they don't understand what we're saying. And so we've got to be better as a public health community, frankly, as a scientific community, in making sure that we are communicating directly and openly. And that's not just the way we communicate, but that's the choice, going back to the top, to communicate, right? It should not be enough to write an article in American Journal of Public Health or American Journal of Prevention or whatever other American journal or international journal that you publish your papers in. There is a responsibility to feed that forward into the community. And it is a question of your belief in equity. Because in the end, if we believe that educational access is patterned by certain demographic issues like race and poverty, then what we are doing in choosing not to communicate to the public is fundamentally patterning the information that we create and we produce on those same demographic factors. And so all we are doing is cementing the inequity around education in the first place. We have an implicit moral and ethical responsibility to be better communicators and to choose to communicate in the public space. And so I really look forward to the conversation. Really grateful to be here with you all today. And thank you again for having me.
Thank you, Dr. El-Sayed. There's so much to kind of pick at there, the intersection between science and politics, the responsibility of people in the public health profession, just comments on the broader political scene. And I want to get to all of that. But before that, I want to take us back a little bit to some of the really compelling biography. You talked a lot about your grandmother in Egypt, but I wanted to also see you get your thoughts on the place of Detroit and Michigan and in your life, because every time I've heard you speak, it's kind of hovering, sometimes really obviously, sometimes more in the background. But it's, you know, I'm from LA and it's a lens through which I see a lot of things. And I think Detroit serves a similar function for you. It's this incredibly special space on one hand. You might say it was like the core in some ways of American greatness in the 20th century, but it's also a real site, as you mentioned when you were talking about the life expectancy gap between different parts of the area, a source of real tension, you know, economic abandonment, racial segregation, environmental racism. And so I was just wondering if you could talk a bit about how the place of Detroit has impacted your political thinking and your subsequent endeavors and so forth.
Yeah, I mean, Detroit is America. And, you know, in so many ways, the history of Detroit is a leading indicator of the history of America. I love Detroit because I love Detroiters. They are some of the most thoughtful, you know, joy-loving and gritty people you'll ever meet. And there is an ethic about Detroit, about, you know, that really harkens back to so many different intersecting trends of American society. And, you know, my dad's journey into Detroit, right, 1978, is part of that. My dad, you know, had three choices: to go to Russia, or Germany, or America. And it's funny because the place he would have gone in Germany is a place called Bayreuth, which is like the Detroit of Germany. And my dad chose to come to Detroit because he believed in the idea of America, that, you know, if he was going to have a shot at belonging in a place, that it was going to be the United States of America. And Detroit, because he wanted to be an automotive engineer. And so we got a fellowship at Wayne State University, it was a public university in Detroit, and got to come here. And what he found was a city that, you know, opened its arms to him and welcomed him, but also, right, in a space that really illustrated all of the inequity in our society, even at the time. Right, and he noticed that there was a white Detroit and a black Detroit, back when there was still actually a white Detroit. And he noticed that there was, you know, the immigrant experience in Detroit was about choosing whether or not you wanted to live and be as a denizen and an actor in Black Detroit or White Detroit, right? And that racialization shaped so much of the conversation because, of course, Detroit itself was shaped so much by race. I mean, the city is well known for the automotive and industrial boom, right? But that came with a lot of decisions that were implicitly made and racialized. Black folks moved up during the Great Migration to take jobs in Ford and Chrysler and GM, and then they were systematically shunted into the worst jobs, the most dangerous jobs, lowest paying jobs. And because they could not get FHA loans, Federal Housing Administration loans, they were redlined into certain parts of town. And then when there would be uprisings against the structural racism of the time, all that meant is, you know, white folks were able to move out of the city of Detroit, get their federally subsidized loans and live the suburban dream, while, you know, to facilitate their suburban life working in the city of Detroit, you had highways that were constructed literally in and over top of, destroying the most vibrant parts of Black Detroit. And, you know, you have I-375, if you've ever been to Detroit, was built over a community called Black Bottom. And I-75 was built, or the M10 was built over a community called Paradise Valley. And they were just destroyed to make room for highways to facilitate the back and forth commute by car of white folks out of the city. And you know, this process has persisted. And in so many ways, it's left Michigan as a microcosm of the United States of America, driven largely by the way that, you know, industrial economics, political movement, and race crashed into each other and led to ultimately Detroit's bankruptcy in 2012, when after which I got to move back. And so it is an incredible city with incredibly rich history. But if when you think about America's worst, its worst instincts and the worst consequences of those instincts, very few places in the country come as high as Detroit does. Maybe Flint, 50 miles north, similar story. When you think about what are the consequences of the way that race has been financialized, and the consequences and the way they've borne out on the bodies of real people.
That's fascinating. I wanted to pick up on this great term that you were just dementing. A lot of students I talked to at Mailman, and also people doing research as well, they're very passionate about social justice issues, but the thing that they always are confused about, that they worry about, is how they'll maintain that after they go into the public health workforce, and all the constrictions that working in organizations puts on you. And I was wondering what advice you'd have for someone trying to navigate this tension between maintaining a sense of political commitment and acting on it, while also not compromising being a good public health professional, medical professional, whatever. How to not lose that side of yourself, and how to not see these in tension, but in some other more productive way.
Yeah, well, I'll say a couple of things, right? More broadly, I think we in public health, especially in public health academia, have to decide if we're more academics or we're more focused on public health. And the reason I say this is because in other disciplines, there is not a responsibility to leverage resources to improve and empower people's health right now, right? Like, you want to be an astrophysicist, that's cool. Nothing you're going to do for a long, long time is ever going to change what the stars do. Not at all, right? And so you have no responsibility. I mean, it's interesting to know, and we should know it. And maybe if there's like a comet hurtling toward Earth, that'd be helpful to know too. And then, and then tell someone about it. Fine. But there is not an implicit responsibility to intervene in the way that we have in public health. And the thing about academia sometimes is it comes with a culture that tends to venerate exclusive knowledge. And the problem with venerating exclusive knowledge is that you start to believe that it's good that knowledge is exclusive. And when you are in a discipline whose responsibility it is to leverage knowledge to improve and empower people's lives, those two things are mutually exclusive, right? And so we cannot be in the business of believing in and succumbing to some of the cultural tropes of academic life, right? Where exclusive knowledge is venerated and supported. In fact, our job is to leverage the tools that we build in the academy into the lives of real people. And that means spending more time outside of the walls of the ivory tower in the lives of actual people, right? I would just say, look, if you want to understand a lot of the ways that these things operate, honestly, go spend some time at a union hall, right? Go spend some time with like an SEIU local in New York, or go spend some time with folks who work on the docks, or go spend some time with some of the folks agitating for $15 an hour. Go spend some time there, and it'll give you a great sense of the mechanisms by which the really interesting abstract ideas that we talk about actually turn into lives and livelihoods for people. And I think when you do that, it'll not only make you a better scientist, but it will free you of this sort of conceit that, when you talk about things in ways that systematically are intentionally used to exclude people, that's a cool thing to do. And, that's a cultural trope that we should all like buy into, right? I always tell folks, like, if you can't say it and a fifth grader would understand it, don't say it at all. It's not worth saying, right? And when you say it, your goal is to only speak to a small group of people. Ask yourself why you're saying it in the first place. And so I just think it's really, really important, right, to pick up all the tools and the rigor of these spaces without picking up some of the conceits in the culture of these spaces. And I think for folks who lead the culture in these spaces, right, there is a real responsibility to ask, all right, cool, now how would you say it to somebody who didn't get to spend most of their life here, right? How would you say it in a room full of union leaders? How would you say it out on the street? How do you turn it into a a chant at a picket line, right? How do you write the opinion piece, or probably even more importantly, how would you turn this into a piece of lit that you could drop at someone's door? These are the things that we ought to be focused on. And so I just, I don't mean to be harsh, but I do mean that sometimes the work that we do, we systematically put behind intellectual barriers. And that's not fair, it's not right, and it's inequitable, and it stands entirely against our value set. And we've got to understand that there's nothing cool about being the only person in a room who knows something, right? I mean, that means you haven't done your job. Honestly, in public health, if you're the only person in a room who's like, think Jon Snow, if Jon Snow was the only person in the room who knew something, right? That's messed up. And so you've got to ask yourself, why is it that we continue to be okay being the only person in a room who knows something? And how do we build a culture of making sure that when we know something, we share something, because there are lives and livelihoods on the other side of it?
I mean, as somebody who was in this space for a very long time and is still sort of in this space, you haven't left entirely. What are some things you think that might be done at an institutional level to sort of move us in that kind of vision of public health, that away from this exclusive knowledge type of culture?
Yeah, I'll give you three things. Number one, I think the tenure process ought to actually reward public engagement, right? So you wrote the great paper in AJE or social science and medicine, and what did you do to make sure it got picked up in the public? Did you go and give a talk about it to the local union hall? Did you turn it into a curriculum to train volunteers at the doors? Did you write the op-ed about it? What was it that you did, right? And I think that like our tenure process ought to reward that, because if you don't reward it, it usually doesn't get done, right? And so you can have an H index of 5 million, and if the only people who know about your work are people who read AJE, it does not matter. I'm sorry, it just doesn't, and you need to make it matter, right? This is the reason we do this work, because it does matter. It can matter, but it only matters if we choose to make it matter, right? And so it needs to be moved into the public space, and and folks need to be a part of doing that. Now, don't get me wrong, I don't think everybody needs to go out there and be like the public communicator of science, but I do think that if you're not able to communicate to the public communicators of science, and you don't find it important, then all we're doing is slowing the process by which really important information gets to the people who can make use of it most. The second thing I think we need to do is we need to teach communication and basic media skills and organizing in MPH and PhD programs. I think leaving our scientists out there when you're talking about the science of public health, public being the operative word in public health, without the basic skills to communicate and to engage with the media and the organizing infrastructure out there, I just think is a missed opportunity. And then the last thing I'll say is that I do think that there needs to be a very clear end-oriented claim on the science that gets done. Like, science for science's sake is like a really lovely thing when you're not doing applied sciences. So, epidemiology, and I say this as an epidemiologist, cannot be a science for science's sake. It just can't. And like, if your goal is to, create the next methodological feature that helps you to estimate some number to the third significant figure instead of the second, like, that doesn't matter. And I know that like that's an anathema to a lot of epidemiologists, but there are people there are people dying, right? And there are people who are being injured by clear processes that we ought to be studying right now. And the notion that we are less interested in these issues, I think it undercuts the ideals of public health. And so we've got to stop pretending like we are a science that just gets to do science for science's sake. Like, we need to do science for the public's sake, because we do public health. And so when they apply for a grant, or they decide to write a paper, they should be able to say, like, this is why this matters now. This is why this can shape something. And it doesn't have to be now. This is why this matters 5 years from now, like climate change, right? I get it. Some of the time horizons here are longer. Fine. This is why this matters 10 years from now. This is why this matters 20 years from now. And if you can't articulate it, right, and you're a really smart person who gets paid by the public, because a lot of this is NIH funded, let's be clear, right, to do this work, you've got to be able to articulate why the work matters. And so, it's something that I just think we need to be a lot better at being able to articulate. Now, I know there are going to be folks who disagree with me, but you asked my opinion.
for sure, for sure. So it's a valuable opinion for sure. Um, you talked a bit about the impact of the Flint water crisis, really kind of human rights atrocity is, I think, the better word for it. And it seemed like it was simultaneously an epiphany for you in terms of what you wanted to be doing with your life, but also not, because you had seen, as you mentioned when you were talking about growing up in the Detroit area, you had seen a lot of the inequalities that give rise to something like that. But I was wondering if you could talk a little bit more about, how you that what you had mentioned. Flint happens, and then it kind of causes some really deep introspection in you and a decision to depart from this path that you were well on your way to succeeding in.
You know, I believed for a long time, for most of my career, that the rate limiting step to action for justice was a lack of knowledge of what to do. And and I came to appreciate that it's not that we don't know what to do. It's that there are a lot of folks whose incentives stop them from doing it. And I learned that when I was at the city. I learned that when I was engaged with the aftermath of the disaster in Flint. And I watched as people who knew the right thing to do systematically chose not to do it because it was either impolitic or because they felt like the costs were too high or because there were powerful and rich people on the other side of doing the right thing who didn't want it done. And I watched as people leveraged these mechanisms that that are intended to look like people are doing the right thing, specifically to obfuscate and stop from doing the right thing. And that was the moment for me that I decided that it had to be a political intervention. I I have a lot of things I don't like about politics. The day-to-day of it, the people who tend to do politics tend to be really attracted to power, and I've never really quite understood what you want to do with power if you weren't going to try and use it to do the right thing. Like, why is it valuable to have power? Why do you enjoy being around power? Like, I've generally found that most powerful people are not very fun to be with. Like, but I also appreciate that, like, it is this exact issue that we tend to allocate power to the wrong goals and the wrong people, that then requires you to stand up and say, okay, fine. Like, if that's what the other side looks like, what would it look like to jump in and try and do it the right way? The other frustrating thing about this system is that it's not just I actually, when I ran, I thought that you needed good I thought in the beginning that good policy sold itself. And then when I ran, I said, okay, no, good politics creates good policy. And now, like, after having run a cycle and been in this world for some time, I've come to appreciate that it's actually neither good policy or politics. It's actually good culture. And it's all of them working together. Politicians are just translators of culture into policy. Like, that's what politics is about. Take our culture and translate it into our policy. And at best, that's what great politicians do. And sometimes really great politicians can make good culture, right? You think about somebody like an AOC or a Cory Bush, who you guys were joined with. These are folks who are really good at making culture, right? AOC is never going to cast the deciding vote on anything. But the fact that we're talking about a Green New Deal is a function of her culture making capacity. And I think as we think about where we're headed, we've got to be really, really clairvoyant about what it means, right, to both help drive culture, drive politics, and drive policy. And I think for a lot of us, we've constantly thought, like I did when I was coming into this world, that good policy sold itself. Like, if you could articulate what we ought to do, then somebody would just do it. And there's not how the world works. And so what we need to be able to do is take that policy and translate it into our values, into the language of our culture, to tell the stories that we need to tell about how the world is and how the world ought to be. And then also leverage that into changing the folks on the ground who are helping to translate that culture into that policy, if we're serious about really making change.
I want to ask you just in a second about your own contribution to changing this political culture. But before I do that, one thing that's remarkable about your campaign for governor is it wasn't that long ago, although it feels like it because of everything that's happened. But it was an unusual campaign for one that was so high profile because it really centered economic inequality, racial exclusion. It was unabashedly pro-immigrant in an era of just really nasty nativism, and it was steadfast in saying you couldn't just work around the edges, that you really had to fundamentally rethink a lot of our systems. And again, it's hard to remember that this occurred before the squad. It was right after AOC's win. People were still getting to know who she was. Nobody had heard of a lot of candidates with these kinds of politics at state and local levels, even though there have been a lot of victories across the country. And I wanted to know, just a couple of years later, where do you see this current, which you and AOC and others were very much a part of? Where do you see this current going, both the positive momentum, but also maybe some of the limitations that it might run into, this progressive wave, if you will?
Yeah, I mean, I think it's gonna keep coming. And you look at even this cycle, right? Everyone from Cori Bush to Jamal Bowman to Mondaire Jones to so many others who are taking seats in Congress. So it's going to keep coming. And at the same time, right, it's going to keep getting opposed. There's a lot of, I think, sort of the traditional Democratic establishment sees this coming, and there's been a really explicit effort to sort of sideline and marginalize this viewpoint. The reason it's coming largely, I think, is just true differences, because we're among friends, right? This is a cohort effect. It is because, cohort of folks who are sort of my age and younger, I turned 36 at the end of this month, have lived through an America that has just fundamentally failed to provide a very basic set of resources for folks. Like, I think about, I was a junior in high school when 9/11 happened. And then I graduated college into the worst financial recession in American history. And now I'm raising my toddler in a once in a century pandemic that's also coupled with the worst financial crisis in modern US history, right? Like this system, right, has and what I mean by the system is like late stage capitalism, this frank rent seeking by huge corporations to increase their power by deregulating our governmental system, the disinvestment in government public goods in general. These together have failed, and at the same time, we're dealing with a public conversation that had been so corrupted by social media, frankly, and the incentives that social media companies have to addicting us to their news feeds so that they can sell us stuff. Like all of these things are the issue, and I think our generation of young people is just coming out of this saying, no, like we need fundamental reform on so many levels. We need to reinvest in basic public goods. We need to strengthen democracy, not tear it down. We need to regulate social media because this stuff's deadly. And what I mean by that is it doesn't directly kill you, but it certainly creates these weird, obfuscated social realities that people tend to live in. And tears apart our social fabric, which then leads us to a failure of public policy that leaves people thinking that somehow wearing a mask in the middle of an infectious disease pandemic is some kind of referendum on your personal liberties. Like it's absurd. And so there is a reform element to that is structural that young people are coming to. Now, where does it go from here? I think it's going to continue to expand. I think that you're going to continue to see leaders who are running on truly deep and profound progressive platforms continuing to move forward. And I think, at the end of the day, what we need to do is make sure that the next generation of these sort of millennial and Gen Z progressive leaders who are hewing younger and browner are also, equipped with a level of technocratic expertise so that when we build the political moment for change, that we're also doing the right things, right? It's not enough, and this is the point that I often make to folks, it's not enough to just say, we're going to tear down the system. Like you got to be able to build something better, right? And it's not even about tearing down the system. So much of what we're talking about is about true investment of government to do basic public or provide basic public goods. And so we better know how to do that well. And so I think the next iteration is that you're going to start seeing a more technocratic left start to build out with real technocratic expertise to be able to take on some of these big challenges and do so in a way that is evidence oriented and driven, but with a politics that is advocating for a real robust public investment in public goods and real regulation against corporations. You know, modern day the modern day robber barons are not, you know, they're not necessarily the bankers. They're, you know, the Jeff Bezoses of the world. You know, you think about what was the difference between Standard Oil and Amazon. Both were lateral, you know, horizontally growing and vertically growing corporations that could just eat everything in their viewpoint. And so it's time for that kind of politics again.
In some ways, this you know, idea of training technocratic people with excellent technical skills, but who are very politically cognizant, kind of sounds like what you hope the public health profession might can aspire to. So last question before we go to Q&A, and just a reminder to folks in the audience, I just hit the Q&A button at the very bottom. If you want to ask a question, you can do that whenever. But you have this concept called empathy politics, which I think is your way of kind of contributing to the culture the political culture that you were speaking about earlier. You know, and from what I gathered, and I want you to explain it a bit more, but you know, it's the position that it's not right just to, it's not just about having the quote unquote right political positions and policies, as you said, but it's creating them with a certain set of values that you use to get to them, to promote them, and to treat people that you're trying to engage with. And I found that just profoundly moving. But for those who are not familiar with it and have not heard you speak about it, could you just describe a little bit more this notion of empathy politics?
Yeah, empathy is one of those words that gets thrown around a lot, but doesn't get defined very well. And just to give you an example of what I mean by empathy, I remember when I was in med school, there was a gentleman who came in being wheeled in with a gunshot wound just over top his leg. And as the medical staff was trying to treat him, he kept covering his leg because, of course, he just got shot in the leg and it's extremely painful. And the doctor, rather than just putting him in restraints, told everyone to stop. And she looked him in the eye. She said, "Look, I'm really sorry that you're here, and I wish you didn't have to be here. But at the end of the day, we have to save your life. And if we can't get to your wound, we won't be able to do that. So I am going to put you in restraints. But here's what I'm going to tell you. If it gets too bad, right, and before this medicine kicks in, just say stop. And every couple of minutes, we'll give you a stop, just a rest, just for a second, right? But then we have to keep going." And so, you know, what it was a recognition of is that this man's short-term and long-term incentives are completely misaligned. In short term, he doesn't want anyone touching his gunshot wound because it really, really hurts. In the long term, he wants to survive because, yeah, he wants to survive. And if he keeps stopping people from touching his wound, he will not survive. And what she was able to do was to put herself in his shoes to understand exactly what he was going through, and to have a moment of saying, "This is a profoundly just shitty human situation. I'm really sorry that you're here. But here's what we need to do, because we need to empower your best instincts over your first instincts." And that kind of empathy applied to our politics, I think, would take us so much further than where we are right now. And what I mean by that is that, yes, we are so focused on what quote unquote the other side is saying or doing that we forget to ask why they're saying or doing it, and what it is that we share in common, and how it is that even when people are behaving so terribly, right, that we need to be able to understand why they're behaving terribly, and how it is that we empower their best instincts over their first instincts. And unfortunately, I feel like, as someone who's from a community that has taken its fair share of marginalization, it is easy to hit back. Sometimes, though, it's more important for us not to hit back, but to step back and ask, why are they throwing punches, right? Because we're not going to get there if our response is the equal opposite to what we're getting against them. All we're going to do is tear this thing apart, and we cannot survive that. And I think about, my daughter and the kind of world I want her to live in. I don't want to live in a world where, one side wins and one side loses. I want her to live in a world in America, where our country makes good on her ideals against her very broken history, and builds out a place where all of us can come together and keep building forward. And that doesn't mean, punching back. That means asking why people are punching in the first place, and trying to do something about it.
Thank you. We're going to go to audience Q&As right now. There's some really excellent questions. This first one, yeah, I'm really curious also to know what your stance is on this. So this person first says, thank you for this talk, but then wanted to get your views on when people use economic arguments for persuading people to adopt policies, as opposed to taking what this questioner calls a blunt moral stance. So using, this will save blah, blah, blah if you have universal health care, versus the social justice stance, I guess. What do you think of that?
Yeah, this gets at the question of what the right framing is. And the problem, the reason why neoliberalism tends to win is because the frame is always in short-term dollars and cents. And I think we've got to resist that frame. Rather than arguing within that frame, we've got to reframe about what's in the best interest of people in the first place, right? Like, I don't care. I mean, frankly, having a job doesn't matter if your job doesn't pay you the basic means, to be able to provide a roof over your head and feed your kids, right? Like, that's not every job is created equal. And so folks are like, well, this is going to take this many jobs. And you're like, well, what is the other hand of that, right? We're going to put how many people in starvation wages? And similarly, like the arguments about the healthcare system that focus only on the cost of the healthcare system tend to miss the fact that the point of the healthcare system isn't to save money. The point of the healthcare system is to save lives. And so we've got to be really good at understanding and appreciating the end outcome of a frame, rather than constantly playing within a frame that we know to be broken. And so we've just got to do a better job of that.
There are two questions here that I'm going to kind of try to combine. I think it's picking up and extending your comments about some of the issues within the public health discipline and profession, both in academia and in practice. And one person asks what changes in training you would make. So for the kind of modal MPH student, what might be different? And I guess PhD student as well. And then the second person asks whether there are disciplines, methods, tools, partnerships, or other innovations that you think are critical for the future of public health, and especially with an eye towards kind of a social justice politics.
Yeah, I honestly think training in media relations and communications, and training in basic organizing, right? What does it mean to organize? How do you get a group of people excited about something? What would it look like to design a campaign on an issue that is a truly grassroots campaign, right? How do you raise the money? How do you engage with key stakeholders? How do you get your message out to folks? What does it look like to have a conversation at a door? What is deep organizing? What is canvassing? Like, these are all issues that we should be teaching in a public health curriculum, because they're critical to public health change. And then, when you engage with a member of the press, how do you do it, right? What does it mean to go off record? What does it mean to be on background? What does it mean to be on the record? How do you do an interview about a piece of your science that really gets at the heart of what you're trying to communicate, and leaves you comfortable and confident having a conversation with someone when you're on the record, right? How many scientists do I talk to who are like, I talked to a journalist and they kept asking me these questions that I wasn't prepared for, and then they mischaracterized my work. And like, we should have a sense of what that looks like and how to do it, right? So you're confident engaging the media. I think those two things are going to be really critical. And then just storytelling, like the process of being able to take a key finding and then put it back into the context of a story, of like, the anecdotal individual who characterizes the key finding of the data, right? So that you can actually put this in a way that people understand. I think if we were able to really invest in training on those issues, it would go so far. And on that point, like, the reason I share my very candid frustrations with sometimes the way we do things is not because I don't think that public health academia matters. It's because I think it definitely matters, and because we need it to matter more. And in order to make it matter more, we have to ask, where is the disjunct in terms of our own psychology about what we do and how we do it, and the way that people think about us and ought to think about us, and the ways in which we can find spaces for interaction that really drive a conversation in the direction that that we need it to go to empower people's lives.
This question comes from a Mailman graduate of SMS who is going to medical school and asks, what do you think the priority should be in training the next generation of physicians? Right, we've talked a lot about some gaps in public health training, but you're also a doctor. So what do you think about physician training?
Honestly, I just don't think you should be able to go to med school without getting the equivalent of an MPH. Like, I just don't think you should, because like it is not okay to not understand the context within which you are practicing. And public health is about the context, right? And so it's like, how many medical students graduate and have no concept of what's happening outside the clinic or the hospital, right? So if you don't know the process that's selecting your patients into being patients, then you have no concept of what you're missing outside of this world and also what you're getting inside of this world. And that really is a problem, right? Because it allows the healthcare system to continue to take advantage of that implicit ignorance in the way that it's set up. And then I also think that, the things that we tend to focus on in medicine are obviously important. You need to know physiology and pathophysiology and pharmacology and all of this, but like, you also just need to be a really good people person. And I think we just don't focus on that enough, right? I mean, the skill that I still use for medical school more than any other is the skill of listening to people in pain, right? It's one of the most important things you can learn how to do. And we don't talk about it that way or think about it that way, but it's a really important skill. And that ability, I think, is one that really needs to be punched up and really thought about, because it's so critical in terms of how you do your job well.
Last question, then we're going to be out of time, unfortunately. And I know I and many others here could listen to you talk for hours, but this is a question that I'm going to combine these two, but it's about your own marginalization. And you ran, you alluded to this a bit when talking about your name, but you ran as an Arab American, a Muslim, and I imagine that comes with, in addition to just the stresses of being a public political figure, you have this additional strain of nativism, Islamophobia, other vile sentiments hurled your way. And because how do you deal with this additional strain on top of that? I imagine, every time you tweet or go on television, there's somebody who is looking right at you with a certain reaction. And how do you cope with that?
I'll say three things. Number one, the people who you usually hear from they don't represent the median. And that's something you have to always remember when you're out there in the public. Like, most people are not the people who had such intense feelings that they felt like they needed to, find your personal email address and tell you how much of an idiot you are. But also, I every day get the opportunity to create a new normal where people with a name like mine, who pray like I do, who look like I do, are a part of a public conversation that extends beyond our identities. For me, one of the proudest moments of our campaign was when they stopped covering me as the potential first Muslim governor and started covering me as a progressive candidate for governor. And I was like, great, I've transcended my faith and name. And that only happened like 3 months before the race, right? But my goal, right, is like, I don't hide from my identities. I'm very proud of who I am. I'm proud to be Egyptian American. I'm proud to be Muslim. I'm proud of the name I have. I don't hide those things. In fact, I wear them proudly on my sleeve. And at the same time, I'm not those things. I am a complete and full human being who has, who wants to be taken with a focus on the things that I am pushing for in the world. But in doing that, in bringing my faith, name, and identity with me, my hope is that I make it that much easier for the next person, right? So that somebody could see themselves in that space and say, I could do that too. And at the same time, I also appreciate that it is unfair in the world to have to be the person who has to carry that baggage. And yet, right? The baggage is there. And if I get the privilege of carrying it so that somebody else doesn't have to, that to me is service. And that's kind of how I think about it. So, I try to find a balance where I'm authentically who I am and I don't hide those things away. And I carry those things and the cost that comes with them in a racist and Islamophobic world, so that the next time, right, it's not abnormal to see a guy named Abdul El-Sayed talking about healthcare, who is clearly and proudly and openly Muslim. You know, and that I hope that that makes it easier for whoever comes next to be able to do it without having to think about how much baggage is left. And sure, there's going to be baggage, but like, you know, if I carried the big suitcases and they've got the carry-ons, like, that's pretty good.
Well, you're certainly doing that, not just for future Muslim candidates, but I think the broader society in general. And I'm so grateful that you were able to make some time to come here today. You know, there's a lot of people with alphabets behind their names, and some people don't wield those alphabets in the most responsible directions. I think you're the opposite. You know, you've got fancy degrees and alphabets behind your name, but you've always wielded that stature in ways that I think are just profoundly admirable. And you know, it's when I watch you speak on YouTube clips when I'm down, it really just always a pick me up. I know you're always traversing the country, doing all sorts of interesting things, but please check out Dr. El-Sayed's book, the podcast, America Dissected. And I hope if your path runs through New York City, which I think it should at some point when things are better, you'll stop back to your former home and talk with us in person. But thank you so much.
Thank you. It would be my privilege. Thank you for creating the space. Thank you all for coming out today, and really grateful for the work that you all do. You know, and so long as we stay focused on the end user, on the folks we serve in this work, I think we're going to get there. So thank you again.
Thank you so much. Take care.